We've been hearing a little bit about Bell's palsy lately with cold and flu season upon us. Here to tell us more about Bell's palsy is Nurse Christina Paris from the VA. Good morning, Nurse Christina. How are you doing today?
Hi, I'm doing great.
Wonderful, wonderful. I want to start kind of at the very beginning. What exactly is Bell's palsy?
So Bell's palsy is like a unilateral paralysis of the face. So it's just, you'll see like one side of your face will droop down. The eye might, the mouth might droop down. And it's usually caused by an upper respiratory infection like a cold or flu. Could also be caused by uncontrolled diabetes. So there's a lot of different things that can cause it. There's no real known definitive cause though.
And how is it actually different from a stroke?
Yeah, so like you said, when we think of stroke and when we're talking about stroke, we are talking about, we tell people to watch for the droop of the eye and the droop of the face. So you're right about that. But it differs because Bell's palsy is just dealing with the facial nerve, where strokes deal with the brain more. It's an injury in your brain. So you're going to just see facial droop. With strokes, you're going to have confusion, difficulty speaking, and concentrating and that kind of thing, more with the brain.
And can you talk a little bit about some of the signs and even symptoms that we should be watching out for?
Yeah, so you want to watch out for weakness to one side of the face, maybe drooping of that eyelid or the corner of the mouth, excessive tearing in one eye, difficulty closing your eye, which can cause your eye to get dry. You might have some drooling and dry mouth because you can't swallow. You might have changes in your taste. Your whole facial appearance might be changed. Because the facial nerve is right in front of the ear on your face, sort of where your mouth opens and closes, you might have some facial twitching. You may have a headache, difficulty with your ears or hearing. So those are all kind of some signs and symptoms that you might see.
And how exactly can we, if we see those signs and symptoms, how are we diagnosed? And is there a treatment for there? Is it a blood test? Can you talk a little bit about that?
So whenever you have something like this, always go and see your doctor, because you don't know if it's Bell's palsy or a stroke, and they're the ones who can diagnose that. They're going to do an EMG, which is looking for nerve damage. They'll do a CT scan of your head or an MRI, and there are some blood tests that they can do just to see what's going on. But anytime you want to go see your doctor, anytime there's changes like that.
Well, this definitely sounds serious. At what point should we actually begin to see and seek out medical attention?
So, yeah, absolutely. Anytime there's a change, because you need to treat those things. If your eye can't close, your eye is going to dry up, so you're going to need to get some eye drops. Sometimes steroids, things like that can be helpful. So anytime there's a change, anytime you have a fever, anytime symptoms go on for weeks or days, anytime you're just having irritation to your eye, you should always just consult your doctor. You can give them a call on the phone and talk to them and see if it's something serious.
Well, thank you so much, Nurse Christina. We appreciate all the details and explanations on this, and we'll see you and talk to you again next week.